and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we're going to talk about Ebola. And I know it's a very scary topic, but we're going to really concentrate on the facts and making sure that people understand what the disease is and isn't, how it's spread, and the preparations that have been made in Hampton and in Virginia should we be faced with that crisis. I have two guests from the Health Department. Welcome, Megan DeWitt and Dr. Nzinga Teule-Hekima. Am I close?
You're close.
All right, from here on out, can I call you Dr. T?
You sure can.
Okay, thank you.
Thank you for having us.
You guys, I mean, this has just kind of consumed what you do professionally for a while now. But people have people have panicked. I mean, there's been this huge fear that has really gripped the nation. Let's talk about what Ebola is, first of all, and why it is so scary.
Okay, Ebola is a severe, often fatal disease. It affects humans, but it also affects some animals such as monkeys, gorillas, chimpanzees. It was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of the Congo. So we've known about it for a long time, and since its discovery, we've seen sporadic outbreaks in Africa. The one thing to know about Ebola is that it must be spread by direct contact, either with blood or bodily fluids. And by bodily fluids, we're talking about urine, feces, saliva can be one, semen, anything like that, but it has to be direct contact for the virus to spread.
And I think that has been, some of the fears. And when you look at it, and one of the few cases that have been in this country, Mr. Duncan in Dallas, he lived in a very small apartment with like 13 people, and none of them came down with it. So I think, or I hope that people began to realize maybe it didn't spread as easily as we initially feared.
Correct, yes.
But I'm not sure people got that.
Right.
Say it again, Megan. How can you get it?
It must be direct contact, so you can't get it by air, by food, by water. You can't get it that way. It's not an airborne virus. So you have to be in direct contact with either that blood or bodily fluid.
So sitting on a plane or a bus next to someone, unless they are ill all over you.
That's the other important thing to note too, along with what Megan is saying, is that the person has to actually have the infection. And so that's the key thing. The person has to have the infection. And so you cannot get this infection from someone who has been exposed to someone else. They actually have to have the infection first. Then you have to come in contact with their bodily fluids in order to become infected or expose yourself.
So that's the other piece of it too. People talk about the incubation period. So let's say, very few cases in this country, and most of them have been people who were caring for Ebola patients overseas and have come back.
Correct.
So they come back, they're not showing symptoms. They're not then contagious, right? If they don't have the fever, if they don't have that virus active in their body.
Correct, they have to be showing symptoms.
Okay. And that's why the monitoring period. And what happens? So someone comes back, I'm a doctor, I'm a wonderful humanitarian, I volunteered my time to help people desperately in need, but I realize, I have exposed myself, like this would be me. But so then what happens when that person then comes back?
So during that time, and this has been an evolution, but at the current point where we're at now, and I think this beginning to mid-October, we now have routed, both at the federal level, state level, local level, we've routed all passengers coming from the 3 countries. And I think that's another point to really kind of make sure that people know, is that people think Africa. It's a really big continent.
Yeah, they don't.
Then they think West Africa, so everything in West Africa. It's only the 3 countries, the 3 countries that are on the watch list, the 3 endemic countries right now, and that is Sierra Leone, Guinea, and Liberia. And yes, we have been hearing some things from Mali right now, and we've been hearing and 2 of the other countries have been on the list, but those 3 are the ones that all of our efforts most of our efforts are focused on. And so it's
Okay.
those 3 countries, passengers coming from those 3 countries have been routed to 5 major airlines. And for us in Virginia, Dulles is the main player. And so people will come through, all those passengers will come through their airport. And when they come through, they're being monitored on several different levels. They're monitored before they leave their country.
Right.
And then anyone that's getting on a U.S. plane, I can personally attest to that you're going to be monitored again, just in general. And then once they get to the airport, they're monitored again. They're monitored for active symptoms. They're asking certain screening questions. And so that monitoring level has elevated and stepped up. Then if someone has been in contact with someone or they're that was potentially infected, then they will undergo this active monitoring period, and that's done based on risk of exposure. So everyone doesn't have the same risk level, and so that monitoring period is 21 days, and what we're basically monitoring for is fever at that time.
And is fever usually the first symptom?
Fever is usually the first symptom, and people will oftentimes add other symptoms to that out of fear. They'll wonder if someone might, I'm coughing, I'm sneezing, I have cold-like symptoms, could that be it? And I think the other thing to really realize is that we are in cold and flu season. And so if you're coughing and sneezing and have cold-like symptoms, chances are you have a cold or you have a flu-like illness, which is a lot more prevalent, a lot more common right now. And so fever is the main symptom that we're monitoring for. And I think that's a very important thing for people to realize.
Okay. So we know what we're doing to contain this disease, but what, are you hearing a lot of questions from people? I mean, what is the fear level out there?
Well, I'll tell you what we have done. People always ask, well, are you doing anything different? Have you done anything different? And what we've always said is this is what we do. This is what public health does. We locally have stood up an incident command structure, and what that means is that we've organized ourselves in a standard manner to be able to respond to a threat or hazard. We are all hazards entity, and what that means is that anything, we respond to all hazards. So this is not, for everyone else, it's highly concerning. For us, this is what we do. So we've trained for this. It's
disease specialists and
right. So that's very important. So if it was a hurricane, if it's Ebola, if it's the influenza, whatever hazard or threat that comes our way, we train for it the very similar way. So yes, we do tailor our response. So we're not going to respond to this the same way we respond to a hurricane, but there are certain foundational things that remain the same, and we are all hazards organization. And so for this, we've stood up our incident command structure the same way. And what we're really focusing on now is education and training. That is extremely important because we know that fear drives actions that could be more dangerous than Ebola itself. And so what was really important for us is while people are asking questions, it's important for us to give them the right information, because if you don't give people the information that they want when they really want it, they come up with their own answer. And a lot of times those answers that they come up with are not they're fear-based. And so it's been very important for us to get ahead of the fear and for us to do a lot of educational and training efforts. And pretty much at this point, we're going wherever we're asked, and we're asking if we're not asked. We're asking to go. We're, at the city level, the city of Hampton, we're doing education and training at all levels, from the top level, from the city manager's office to individual departments. We are looking at school systems, we're looking at businesses, we're looking at everyone who will allow us to come and talk to them. We want to talk, we want to get that education and training out. And it seems you never know. A lot of times public fear is dictated by what's happening,
right.
And what's happening in other states and what's happening in other countries. But we remain vigilant, but we feel like our education and training efforts are really on the right track for us, and we feel like we're giving really good messages. We've gotten, and Megan can speak to the response that she's getting when she's going out and our teams are going out.
Yeah, so we go out, as she was saying, we do presentations because we want to get ahead of that fear. And the general questions are just, how can I get it? How can I protect myself, protect my family? And as we've been talking today, the key message is just, if you have not traveled to one of those affected areas, And if you are not in close proximity to someone who is infected with the illness, then your chances of getting it are very unlikely. It cannot be spread that way. So it's important to know now flu season's out there. That's so much more important.
You know, that's one of the things I have heard several people say is that, especially in this country, more people are going to die of flu this year than are probably going to get Ebola.
Right.
Well, how do you, and when that flu hits, and I'm hearing some signs that it might be hitting early this year, you know, I think that's going to raise the panic level again, because the first symptom usually of both might be muscle weakness, fatigue, and fever.
And that's why doing that at that time is very important to kind of sort out. I mean, there are questions, screening questions, evaluations that we're doing. And so, yes, there are several infections that can start off very similarly. A lot of viral and bacterial borne infections start off with fever first. But then that's when you start to kind of drill down into those questions. You know, if that person has flu-like illness, have they been to those 3 countries that we spoke about before, Liberia, Guinea, and Sierra Leone? Have they been there? Because a lot of times what we'll get is that they've been traveling. Anywhere overseas makes people nervous. Anywhere in the continent of Africa, people, Africa is pretty good size landmass. And so it's really, that's a really important job of public health, to be the consultant to all the medical providers, hospitals, doctors' offices, to really screen those questions. And so, yes, they can present similarly, but do you have the risk? Because if you don't have the risk, if you have not been in contact with someone who's infected, even coming from one of those 3 countries, you know, it depends on what you, a lot of times, it depends on where you have contact, and what you were doing, and did you have exposure to anyone infected? That's, you know, all those questions become very important, because yes, it does present the same at the very beginning. There is fever in a lot of illnesses and a lot of infections, but that does not mean that the risk is the same, or that there's even a risk, that the risk of infection from Ebola is very likely. So those questions are very important to ask at the beginning.
Yes.
So there is something you can do to reduce your risk of flu, though, right?
Yes, of course, yes. Of course, get vaccinated. We do have a vaccine in the Hampton Health Department, and we have a vaccine in the area at the doctor's offices have and the local pharmacists have it, but of course we have it at the Hampton Health Department. And then also just those standard things that we tell you to do: wash your hands, wash your hands, wash your hands. And then also we tell you to make sure when you're sneezing or coughing to do so in your arm, and and just kind of the other big thing that we say is, if you're sick, stay home.
Gosh, yes, that's so important. You don't need to infect the rest of the office, whatever it is.
Right.
But again, that's not how, generally speaking, Ebola is spread. If someone even in your office working next to you had it, you would not likely get it unless you had that direct
unless you had that contact with the
fluids.
bodily fluids. Yes.
Well, let's just talk really briefly. The hospitals in Hampton Roads have also been going through preparedness. There are certain designated places that if there were a suspected Ebola case, they would go.
Yes. So any hospital can accept an Ebola patient as long as they follow standard Center for Disease Control recommendations, and they have a room where they can isolate that patient with a bathroom. However, here in our area, we have 2 hospitals that have stepped up and are prepared to accept Ebola patients, one being Centera Virginia Beach General, and the other one is Centera Williamsburg Regional Medical Center.
So, and that's nice, they're able to make the preparations and to, sort of specialize and train people. Not that everyone can't, but, you have that preparation. The other thing I want to talk about just briefly is the military. Because we have had teams setting up hospitals in the affected regions, not necessarily in contact with patients though, because these are new hospitals not being used yet. But the Air Force is taking some measures to monitor.
Yes. Yeah.
Yeah, and they and before I even answer that question, I think it's very important to understand how public health is working and with this Ebola response. We are coordinating. We are the lead agency in terms of coordination, in terms of consultation and information and training and education. And so we are coordinating with all the local hospital systems that we just spoke about. We're also coordinating with the military. We are in conversations, and we know what's going on with those teams that are coming back and that have been deployed and when they will come back. The military units have set up active monitoring of their own, and so they have their own monitoring stations on their bases where they're monitoring these people. We are in communication with them to know what the risk is, and it's kind of like we've said earlier, the risk, even if you were in one of those 3 countries, it all depends on who you were around and what you were doing.
Right.
Your risk if you went over to provide medical care or medical assistance is going to be different than if you were there constructing a hospital and you were outside and you really didn't have any contact with anyone that's infected. Mm-hmm. But just like our regular standard civilian passengers that are coming back and being monitored, the military is doing the same for its folks, and we're in coordination with them too. So you're coming back and you're being monitored for that 21 days, and looking at fever as being the marker that we're monitoring for. And that is something that's very well coordinated, and we're an active part of that as well.
All right, and then the other thing I want to say is that the part of the reason for the heightened levels of panic is this disease is fatal a majority of the time, at least in the African nations where it's originated. With early diagnosis and very good standard of care here in this country, that hasn't, it's a little early to say, there have been so few cases, but it has not been always the outcome. Is that fair?
Well, Ebola has a 50 to 60% fatality rate. There isn't a treatment for it at this time, and so all we can do if someone does get infected is provide supportive treatment. So the degree to which you're able to provide supportive care to your patient is the degree to which they have a better chance of survival. And so that how that occurs depends on where they're at. So if they're somewhere in a location where it's very difficult to provide that level of care for them, then their risk of survival is going to be a lot lower. Mm-hmm. But if you're somewhere where you have access to, all these different services, and we're able to provide a high level of supportive care, then your risk of survival is a lot higher.
Okay. And I want to end on that note because that was like the scary note. So let's just recap for people. How can you get this disease? Megan?
Direct contact with blood or bodily fluids, meaning, urine, feces, semen.
Okay.
From someone who's infected.
From someone who has an active infection, not just
correct.
who has a risk
Correct.
or who
Right.
may have been exposed and we don't know yet.
Right.
Okay. Now, if people have questions, where are some places that we didn't answer today, or maybe they're talking to a friend, where do you send them for more information?
Virginia actually has an Ebola hotline set up, so you can call 1-877-ASK-VDH3. So any additional questions that people may have, they can do that. We also have a website where people can log on and request for talks, community talks, and that is peninsula.community.events@vdh.virginia.gov. I know it's long.
That's long, right. And under hampton.gov, you can go to the health department's website, and we have some information there, and then it links out mostly to the state.
Definitely. Virginia Department of Health or the Center for Disease Control and Prevention, both great websites for additional information.
Okay. Well, thank you. Thank you both for coming by. I appreciate it.
Thank you.
Thanks.
And thank you for watching. I hope you have learned some facts about Ebola, because the best way to understand what's going on is to take the time to really listen to the facts and not so much the headlines and the hype. And if you do have more questions, you know where to get them answered. Our health department here locally is doing a tremendous job of preparation should an outbreak occur, but again, not a panic at this time. We're very calm. Thank you for watching.